eye treatment has been around for over 15 years internationally. In Ghana, however, it is something that is new to us. So today we're here at the Interstar Eye Clinic and Laser Eye Treatment Center to speak to Dr. Adam Yakubu Seidu, who is an eye surgeon, to educate us on the topic. And as you can tell, we need to be clothed well to be able to have access to the treatment center.
We have got different type of laser treatment that we do. Previously, we had some other lasers that take care of diabetes, take care of sickle cell patients, take care of people with retinal breaks. We use it to do laser cataract surgeries. The intention is to do the cataract surgery with minimal trauma to the eye. Actually, what it does is when we are doing the cataract surgery, there are certain steps that we do, the human being. There are certain things. You enter the eye, we do an incision, enter into the eye. When we enter into the eye, the natural lens, the crystalline lens, is in the form of a cap. You have to open it to remove the lens that has become opacified, the nucleus. So when we open, normally we use our eye to do something we call capsulotomy. And believe you me, no matter how perfect you are, you can do it today. Like you say, I want a 5 millimeter circle, the diameter 5 millimeters. You can do it today 5 millimeters. Maybe tomorrow when you are doing it, you can get it 5.5. Maybe the next day you are doing it, maybe you can get it 4.5, 4.8. But with the laser treatment, you enter into the machine. I want my capsule 5 millimeters. Now the computer takes over everything. So normally you enter from here, the cornea. Now you now indicate to the laser machine, I want a 2.7 millimeter cut from inside. And by the time I enter the eye, I want it to be 2.8. That the laser will do for you. The capsulorhexis we call, I mentioned earlier on. You just tell the laser machine, you feed it in, like here, I've entered 5 millimeters. So I get a diameter between here and here, 5 millimeters. And it's precise. You cut it in such a way that it wouldn't leak. So the laser will come in this way, stretch it that long, and enter the eye that way. You see it. This is the cut the laser will do for me. Precision. It gives you, repeater, you can repeat it a number of times, you get 5 millimeters. So when you do that, the incision, so we call it bladeless cataract surgery, because you won't use any form of blade. The other important step there is to break the nucleus and bring it out. That the laser also does. The laser, if you want the laser to break the nucleus into 6 for you, the laser will break the nucleus into 6 for you. Unlike before, we open a big wound. In the end, you put the lens inside. Now because the wound is small, we put the lens into a smaller cap, like an injector, then we inject the lens inside for us.
You talked about the cataract surgery.
Yes.
Is there other types?
We have what we call LASIK. People who wear glasses and now choose to say he doesn't want to wear glasses. He's fed up with glasses, fed up with contact lenses. So this now says, I'm just substitute.
I have an eye defect and I wear glasses like you said, and I don't want to wear glasses or I don't want to wear contacts anymore. Are you treating it permanently?
With this latest technology, what it does is we don't even have that regression, we call it. I mean, if you were -10, we treat it and you are now 0. After 2-3 years, now it counts -1, -1.5. We call that regression. That is not there.
So let's quickly go and attend to our patients on the other side, and then we'll continue with that.
before you can perform the LASIK. All the operation is done on the ocular surface we call cornea. So what you does is, before we used to use microkeraton knife to form a flap. After the formation of flap, you now come to your excimer laser. The excimer laser will now reshape the cornea for you. And that is when the numbers are eliminated. The introduction of the femtosecond laser, that is the FS200, is to limit the complications. Because before, if you use a knife, there was a possibility that you could perforate, you could enter the eye. Now that has been eliminated. So he comes in for the procedure, walks home without his or her glasses. The side effects are basically after the treatment, in 3 months, you might be forced to use artificial tears. In any case, people who use contact lens also use artificial tears to lubricate the eye. Because when you put the contact lens into the eye, sometimes what happens is the eye is prone to dryness. So you just put in the artificial tears. That lubricates the eye for you. Till now, mainly that is the commonest thing, and we don't call it complication.
With advanced technology also comes cost. How expensive is laser treatment?
Actually, when you do the calculation, every 2 years you have to go and change your glasses. If you put that into perspective, if you put that calculation together, relatively it's still cheaper. We've tried to introduce this in Ghana because sometimes people travel outside to do these operations. And the cost at which we do it here is just equivalent to the cost of an aircraft ticket.
Which is?
It's in the range of 5,000 Ghana cedis. And that is for the 2 eyes. We have lots of people coming in. Because it's new, like you mentioned, people are thinking of complications, thinking that, oh, I only have this in my eye, which is very precious. We also have conditions we call keratoconus. The keratoconus is a condition in which certain areas of the eye becomes weaker. Because they are weak, what happens is eventually there's protrusion in some portions of the eye. And that is another indication for the usage of this system. All in all, the treatment per se does not take 1 minute. The healing, normally when we do the procedure, we ask the patient to wait for about 30 minutes. We'll see the patient to make sure that everything is fine. The next 2 hours, the patient is fine. But we would advise that he refrain from rubbing the eye at least for the next 2 days. Sometimes it depends on the cost and sometimes on the preference. But all in all, you can either choose to use glasses. If you are not comfortable with glasses, some people will say they don't want to wear glasses for so many reasons. And that depends on the person. And contact lens. If you are able to move from glasses to contact lens, the quality of vision becomes completely different. And you leave contact lens to do LASIK, we call it supernormal vision. It gives you sharp vision. In Ghana, I think, as far as I know, it's only Interstar Eye Clinic and Laser Center. And this, we just introduced it in the last 6 months.
Thank you very much.
Okay, you're welcome.
Speaking to Dr. Adam Yakubu Seidu, who is an eye surgeon with Interstar Eye Clinic and Laser Center, and he's been educating us on the topic of laser eye treatment. If you can afford it, why not go for perfection?